young women feel about having to do a hysterectomy?
I would feel crushed because now the parts that make me a woman have been removed. I can't have my own child. Now I have to adopt. But then eventually I would come to terms with the fact and then I would do it because it's for my health. And it's for my future so that I can live longer.
I'll be sad because I won't be able to give children anymore. I won't be able to be a woman that makes me a woman, because this thing, it's very important considering marriage, family, because a partner can actually leave you for that because you can't give children. So it's very important for you to do what's best for you. Think about yourself, think about your health. I would do it for myself.
Firstly, I would feel depressed because eventually at the end of the day I would love to have kids, but if it's for my health, then there's no other option but to remove it. And if the husband, he really loves me, he'll love me for who I am and for what I have. But if he doesn't, he'll go.
I would allow them to remove my womb because there are a lot of ways of having children. There's adoption, there's a lot of ways that I can have children. So I cannot live with a disease that I know that it's bad.
Right, so uterine fibroids are the most common form of non-cancerous tumors that grow along or within the walls of the uterus. Now, about 70 to 80% of women will suffer uterine fibroids by the time they reach the age of 50. Yet only about a third will know that they have fibroids, as most women experience no symptoms at all. Now, hysterectomy is the last resort among many other ways that fibroids are treated. And people often react differently to the thought of removing their wombs, as you heard in the clip earlier. Now, the many other questions women ask are the fibroids dangerous? Can they turn into cancer? Can I fall pregnant after being diagnosed with fibroids? Are they preventable? How are they treated? Well, that's what we're going to tackle in today's show. We'll discuss uterine fibroids, and our guests today include a specialist gynecologist, an interventional diagnostic radiologist, a homeopath, and two women who will share their stories with us on the impact that fibroids had on their lives. Now, be part of the show by asking the panel some questions or simply just sharing your views with us. The number to call is Johannesburg 714-6918 or 6919. You could also tweet us at SABC Health Talk or simply just interact with us on our Facebook page, SABC Health Talk. So sit back, relax, and learn from this bumper show ahead, coming to you just after a short break. I'm Dr. Salome Daung, and this is Health Talk.
Life can throw all sorts of surprises at you, often when you least expect it.
Sorry, Mom.
That's why it's important to have medical cover. Me? I didn't want just any medical scheme. I wanted a scheme that I could rely on, that I could talk to at any time, that I could afford. I didn't just get medical aid. I got medical paid.
We pride ourselves on being impartial as well as independent. On the agenda, we basically break down the stories of the day.
Give the viewer the assurance that we will cover every side of the story.
Tear gas has now been also thrown at the protesters.
We are peacefully marching and the police is stopping the people. They're hitting the people who are spraying the people with pepper spray. These people are supposed to protect us, but they are against us.
We are pushing them back by using the rubber bullets because we cannot allow them to block the roads and damage other people's property.
Quite important to bring on board all sides and hear what everybody has to say about a story, especially being the public broadcaster.
All in all, we basically take the news agenda of the day forward.
After years of visits to physicians and relying on painkillers, Nozipho Dlwati was about to find out what was causing her excruciating pain.
I have always been suffering from severe menstrual pains. And then my mom took me to the doctor to have me checked out. They thought it could be endometriosis. There was a bit of endometriosis, but there was also a fibroid, which were minor at that time. And I was told it's nothing major. They're not going to do anything about it right now, hoping that with time, they will go away on their own.
Like many women, she had no idea what fibroids were.
I don't know what fibroids are. I've never heard of that, And I did do my research, and because the doctor tells you that no, it's nothing you should worry about. It'll probably go away on its own. You relax and you think, I shouldn't worry about it. Everything will be fine. And yeah, I went on with my life as normal.
The following year, after finding out she had fibroids, the pain became unbearable and Dlwati had to go back to the doctor.
And it was in 2016, I think, when I went back. I went back to the doctor because my pains were just not getting better, And over the year, they had been doing checkups and there was no fibroid. But that year, my daughter decided, let me do a laparoscope and actually see what's going on in there. Then that's when they actually realized that the fibroid has grown as big as my fist. So it had to be removed.
While being operated on scared Dlwati, being told that there was a chance that she might not be able to have children left her traumatized. Her journey of finding alternative treatment began.
I went to see my GP, who then told me that no, there's another doctor who does it a different way. You can contact him and see if he'll be able to help you. And that's what I did.
Okay. What was the procedure?
It was called embolization.
The embolization went well, and a year later, Dlwati became a mom. She says that she is free from heavy menstrual pains, but she feels that not enough information is out there on fibroids.
Having fibroids is something that's also a major in a person's life. It's not something that's minor. It's something that could just change your life from what you thought it could be. So I think there should honestly be more awareness with regards to this topic.
All right, and that's exactly why we're doing a program like this, to drive awareness, just so that we all know what we're talking about. And I'm not going to do that alone. I have experts who will help us tackle this idea of, at least this topic of uterine fibroids. And with us today, it's a great pleasure to welcome Dr. Lusanda Shimange Matsuse, who's a specialist gynecologist and obstetrician from Charlotte Maxeke Johannesburg Academic Hospital. Welcome to Health Talk once again.
Thank you for having me once again.
Right. All right, let's start from the beginning.
Yes.
Fibroids. What are we talking about?
Okay. So fibroids are tumors or growths that are found in the womb of a woman.
Right.
They're non-cancerous.
Yeah.
So in other words, they don't have cancer. They're not cancer.
Right.
Yeah. We normally find them in women of reproductive age, so women who have potential to fall pregnant.
Yeah.
But that's not to say that we can't find them in women who are menopausal.
Yeah.
Okay.
Does that mean that they start growing, in women at those kind of ages?
They start growing in women in the reproductive age. And another thing to note is that they're more common in African women than they are in Caucasian women, 3 times more common.
Really? What is the reason for that?
It's all theories that have been based. Is it diet? Is it access to healthcare that by the time they are found, then they've already grown so big? Is it based on where we are in the world? Because the fibroids that we see compared to our counterparts when we in congresses is 2 different types of fibroids. I mean, they get very surprised at the size of the fibroids that we see. So it's all theories really, and there's also a genetic predisposition. So if you've had family members who've had fibroids, it's very possible, especially if it's a direct line, such as your mother or your sister, it's very possible that you could have them.
Okay, so age is not a risk factor here?
Age is a risk factor if you are of reproductive age.
Right.
Right. So I would expect a patient or a lady who's maybe in her late 20s, in her 30s, to present with fibroids rather than someone who is in her 60s or her 50s.
Right.
And if a woman in her 50s or 60s does present with fibroids, then we have to investigate further. Is this really fibroids, or could it be something else?
Okay.
Whereas in the reproductive age, it's most likely a fibroid or fibroids.
I suppose the next question is, I mean, in my introduction, I said 70 to 80% of women, probably more, and the fact that, a lot more don't know that they have fibroids. Do we know exact statistics?
Look, I mean, depending on what you're reading, some literature says 25%, some literature says 75%, some literature says 40%. But what we know is that it is very common. But not every woman who has fibroids would necessarily present with symptoms of fibroids. Okay. There are a lot of women walking around who don't even know that they've got fibroids, and it could be an incidental finding when they come complaining of something, and then they do an ultrasound scan, and then you find you've got fibroids, but they never knew, had no clue that they had fibroids at all.
Okay. Before we talk about those symptoms that you spoke about, let's talk about other different types of these fibroids, by the way.
So you don't really get different types, but they're found in different positions of the uterus. Right. Okay. So a fibroid is non-benign tumor found in the uterus, in the smooth muscle of the uterus. And then depending on where they're positioned, so you can have pedunculated fibroids, meaning they're actually outside the uterus and they're hanging with a stalk, or they're inside the muscle of the uterus, or they're inside the actual cavity of the uterus. Right. And sometimes they even prolapse through the mouth of the womb. So it's more about the different positions which will give you certain symptoms, rather than the different types of fibroids that you get. Okay. But with that being said, fibroids do undergo certain changes, but it's still a fibroid that grows from the smooth muscle of the womb.
And let's just re-emphasize the point again, and perhaps let me ask the question. It is not cancer, so they don't grow into cancer, or can they?
They don't grow into cancer majority of the time. And when I say majority of the time, I'm saying like 99% of the time. Right. But there is a small percentage where you do get malignant transformation, so they can turn into cancer. And those are your older women where you have more rapidly growing. So she'll give a history about this mass that's just been growing over a year. To us, we think it's a fibroid. When you look at histology, then it ends up being a cancerous fibroid. But that's more your older women, and they really do present almost the same, but then on probing, then you can more or less figure out, okay, we're not just dealing with a straightforward fibroid, there could be something else in this woman.
All right. Yeah. So I guess for people watching the program, they'll then want to know, okay, how will I know that I have fibroids, or I think I may be having fibroids? Typical symptoms.
Okay, so typical symptoms, you have heavy menstrual bleeding. So when you go on your period, you're just exsanguinating, there's clots coming out, using a lot of pads, using a lot of tampons, or whichever sanitary wear you're using. And then we've got pressure symptoms. So either you're constipated all the time, or you find that you need to go and urinate all the time. Third one is more cosmesis, so you just have this mass that is bulging, and you know you're definitely not pregnant because you've done a pregnancy test, or you're not necessarily sexually active, and it's just growing, and it gives you that look as if you are pregnant. And then another one is fertility problems. Perhaps you struggle to fall pregnant, and depending on where the fibroids are situated, or you do fall pregnant and you keep having repeated miscarriages, or you do fall pregnant and you just have babies earlier than the stipulated 9 months. And then lastly, it's pain. It's pain when you have your periods. Right? But even with that pain, I say that with caution, because you still have to look for other causes of pain, because those first symptoms that I described, those are the most common ones. I'm not saying pain is not a symptom of having fibroids, but you normally have to look for other causes as well.
I guess it's kind of difficult. Perhaps, it leads to the question of saying, how then do you diagnose fibroids? Because there's many other things that can give exactly those symptoms that you spoke about.
There's a lot of overlap. So typically you'll have a patient who'll come in, most of the time they come in complaining about heavy, in fact, any of those symptoms, right? And it's up to us as clinicians to take a proper history. And we know with every consultation that we do, part of it would be your examination and your investigation. So in your investigations, that's when we do our ultrasounds, and they've got typical features on ultrasounds that we can say, okay, fine, you've got fibroids, this is most likely what the cause is, depending on what the patient came complaining about. And so that's basically the mainstay or the gold standard of diagnosing fibroids is on ultrasound, because then you can see where they are situated, could they be possibly causing these symptoms, right? And we can look at the size as well. So if it's a fibroid that's inside the cavity of the uterus, then we can say, okay, maybe the reason that you're actually having these repeated miscarriages is because you've got all these fibroids sitting inside the uterus. Or we see that your tubes are blocked because of these fibroids. That's why you're not falling pregnant.
Yeah. All right. So I guess back to people watching the show to say, okay, you've listed all of these symptoms, and at some point, whenever I had my periods, perhaps for 2 months, I had a bit of pain, but it disappeared. At what point should one say, I think I need to go and see my doctor?
That's a very difficult one. And I'm really saying that because you get some women who can just really deal with the pain and the bleeding. And by the time they come, they have these massive uteruses, that we need to try and save. And I always just really tell women, what's normal for you. And so whatever is abnormal, rather come and be given a clean bill of health rather than actually stay at home and say it's nothing. So I'd actually rather have a patient who says, no, listen, this month I really bled heavily and I've got a bit of pain, and I examine her myself, take a proper history, examine her and do an ultrasound and say you've got nothing to worry about, than someone who's going to sit at home for over a year or even over 5 years. And then she comes to me when now she wants to fall pregnant, and then she's just got all these fibroids all over the place. And then, it kind of like limits our options in terms of treatment.
Right. So what is then the clinical course? And I guess the other related question is the severity. Is there different types of severity, based on your experience?
Look, it depends what they present with. So let's just take someone who comes in complaining of heavy menstrual bleeding. She could just have heavy menstrual bleeding every month, and then her period finishes, and then next month she has heavy menstrual bleeding. Then with that, in terms of severity, it's someone who comes in who's completely unstable, needs to be transfused blood, needs to be given medication to stop the bleeding. That would be the spectrum of severity in terms of bleeding. And then in terms of pressure symptoms, yes, she may have occasional constipation or needs to urinate all the time. But then now the other end of it, in terms of the spectrum of pressure symptoms, is when now we're blocking the tubes, the tubes of the kidneys, and then she gets enlarged kidneys because of these massive fibroids.
Okay. The last question before we leave, the whole notion of endometriosis and fibroids, is there a link?
So there is not necessarily a link between endometriosis and fibroids. And now this takes me back to the whole issue of if you have pain and you've got fibroids, then you have to think, does this patient have adenomyosis, which is a form of endometriosis, if I can put it that way. So not just to immediately say, it's the fibroids, because you could scan a patient and there is actually no fibroids, but she's still got the pain. Then you have to look for something else.
Only people like you will make that sort of decision. All right, time for a quick break. When we come back, we continue our discussion on uterine fibroids, and we speak to people who are going to share their stories with us on how this affected them. Please stay with us.
To be a part of something like this makes me proud, and I think that to be able to report the news in a fair, just, independent and impartial way is what the public broadcaster stands for.
Welcome to the Full View here on SABC News. It's great to have you with us.
You're not answering what I'm asking.
I'm saying to you, none of the commitments were ever met.
No, that's not true.
None of them were ever met.
That is not true. No.
The Wanyama Trust was not an act of the national government.
Is somebody suggesting that the one who happens to have a white skin should be subject to expropriation without compensation.
But again, I put it to you that has not been conclusively decided. That's what this whole process, which you are a part of, in making your submissions, will decide. We don't know what the final beast will look like. And until we do, all you're doing is fear-mongering.
No.
Welcome back. We're talking uterine fibroids. Our special guest, Dr. Lusanda Shimanga Matsuse from Charlotte Maxanke Johannesburg Academic Hospital. And we're now joined by two other special guests. First up is Tulofelo Mokhane, who's going to tell us about share her story with us in terms of, what she's been going through, suffering from fibroids. And then, of course, we also have Kekeletso Tamai, who also will tell us about, her journey with fibroids. Welcome to Health Talk, ladies.
Thank you.
All right, we're going to come back to you now. Let's start with you, Doctor. In fact, before we do, we have a caller on the line. This is Kolani from KwaZulu-Natal. Kolani, welcome to Health Talk. Is Kolani there? Okay, we'll get back to Kolani. Let's come back to you. I know we've spoken about the clinical symptoms and what have you, but we're thinking here of long-standing, fibroids that have some sort of effect or impact on a being and are left untreated. What are the possible complications?
So the ones that I would really worry about, first of all, with regards to the patient, is that it does affect your quality of life. You've got this massive thing growing inside your uterus and you're not doing anything about it. So basically, from a female point of view, maybe there's a element of vanity, everyone asking you, so when's the baby coming? When's the baby coming? But you know very well that you're not pregnant. You've just got this mass growing inside of you. And then the other thing is that if left untreated, they're actually going to grow bigger. Remember, it's women of reproductive age. So in terms of the physiology that contributes to their growth, that continues as long as you're of reproductive age. So eventually then the most severe would be if they pressing onto the tubes of the kidneys that I spoke about, and then you get enlarged kidneys. That would really be the most severe, if I can really just specify one thing, if left untreated, is the fact that they continue to grow and they continue to grow. And the enlarged kidneys.
And I suppose the bleeding part?
The bleeding will carry on, especially depending on where they're situated. If it's just the one that's hanging off a stalk and is actually outside the uterus, then that won't really have an impact on bleeding. Right. But if it's the ones that are growing inside the lining of the womb, then those will have an impact. So you will continue to bleed. You will have repeated transfusions. We've had patients where they get admitted over and over again for transfusions. So definitely.
Okay. I believe Kolani is back with us. Kolani, welcome.
Yes, hello.
Yes, Kolani, hi.
Yeah, I'm all right. And you?
We're good, thanks.
Yeah. Hey, I see this program on the TV now. Hey, it's been a long time. My girlfriend has been suffering this what is it?
Fibroids.
Yeah, fibroids.
Yes.
So she's been, I took her to Africa Hospital.
Yes.
They did a water test smear.
Yes.
On her. Yeah. So they said she must come back another day. Maybe it's about 3 years now. She's been moving up and down on this thing. They transfer her to King Edward Hospital. She don't get help.
Okay.
Now they said her blood is too low. They can't do the operation to her. Now this thing is keep on worrying her. Even in the morning today, I bought some tests for her. She's breathing one way.
Okay. All right, Kolani, thank you very much. You're asking very important questions, and we're going to be tackling them soon. And Dr. Matsuse, I'd like you to keep that at the back of your mind, because this is about treatment, access to treatment, how long it takes for people to get treatment in the public sector versus the private sector, and so on.
Okay.
All right, but for now, I'd like us to speak to our special guest. Let's start with the lady in the middle, Tulofelo.
Hello.
Tulofelo, you look a little bit tired this morning. Is it something to do with what you're suffering from, or what you suffered from?
What I've suffered from, because I'm from an operation. I did my operation last week, Thursday.
All right.
So I'm kind of like still in recovery.
Oh, okay. Tell us about it. What you had fibroids, obviously.
Yes, I had fibroids.
When were you diagnosed with fibroids?
Last year.
Right.
But all this time, I didn't know that I had fibroids.
Right.
I just thought irregular bleeding. It's something that's known to me, and my cycle wasn't regular. You know, I'd go for 5 days. Next month, I'll go for 7 days. You know, I'd be fine with that. But then I started going to specialists, and then they're the ones that told me that no, you've got fibroids, which are growing all over. My tummy was, I'd literally look like a pregnant woman, and everybody would ask me, when are you giving birth? And I'm like, dude, I've never been pregnant, and I'm not trying to fall pregnant. So
Okay. If you don't mind asking, how old were you last year when you were diagnosed?
27.
27. All right. Okay. All right. We'll come back to you about the operation and you know how big they were and so on. Let's bring in Kekeletso. Kekeletso, when were you diagnosed with fibroids?
In 2013.
Right. Tell us the story. What was wrong with you?
Okay. I had severe bleeding. My periods were very heavy. Clot. Severe constipation, lower back pain. That was the worst thing. Like then I decided to go to the hospital. Then they said no. The doctor checked and examined and everything. Said no, there's something wrong. So we must refer you to the gynae. So I went to the gynae. They referred me to the sauna. They did the sauna. Then the report says I have a 20 centimeter fibroid. Then I went back to the gynae with the report. He said, no, there's nothing we can do. We must remove the womb.
Remove the entire womb?
The entire womb is like, no. It's
and
not
how
going
did
to happen.
that affect you? I mean, how?
I was affected mentally, spiritually, physically, everything, Jay. It was bad.
Yeah. And then what happened?
Then they said, no, you must come back when you are ready for the operation. There's nothing we can do. It's like you're 5 months pregnant now, but there's nothing we can do. We must just remove the womb. Then I went to Louis Pasha for the MRI. Then they did. Then they said, no, we'll send the results. Just go. Then I went back home. I think it was on Monday. By Thursday, I received a call from radiologist. It was Dr. Matela. He said, no, we saw your scan. You must come. There's something new that we want to talk about. There's something new here, something new so that we can talk and we see how we can deal with this thing. So I came back. They said, no, there's something called embolization. We can try to embolize and try to shrink the fibroid. Then yes, that's where I met Professor Tsatsi. Then we talked about it, then said, no, it's fine, we can try it. Then I went to Unitas in 2013 June. We did it. Then after it was 20 centimeter. Then 2014, 2015, I came back again. Now it was 10 centimeter.
Oh, really wonderful.
Then said, okay. In June, we did the second embo. Towards the end of August, early September, we did the third one.
On the same
year, in 2015.
Right.
Then, okay, after the last embolization, I got sick. I was sick, like sick. Then I just woke up in the morning and said, I'm going to see the prof now. There's something wrong with this embo. Then I went there, I explained everything, what is going on. There's something wrong. I'm sick. I will sweat, get cold, there's severe pain, there's something wrong. I just told him there's something wrong. I don't know what is it, but there is something. So he sent me to the scan. They found that the fibroid now it's dead. It's like something like it's rotten. There's a pus inside. So they said, okay, they did the scan. I came back.
So you did another operation to
I had to do a myomectomy. I went back to Louis Pasha for myomectomy and everything.
And you're perfect now?
Now I'm fine.
That's great. Let's come back to you, Tsolofelo. How big was yours? We've heard that she had a 20 centimeter, and how many did you have?
Oh, my ones, I don't know exactly. I think there were 9, if I'm not mistaken. And they were quite huge because I think I had one that was literally on my uterus pressing because I couldn't keep my bladder in. If I had to go to the toilet, I needed to go to the toilet, else it would be disaster. So I think it was 20 or 22 meters, I'm not sure. 20 centimeters.
Right. So the operation that you had, what did the doctor tell you about what you were going to be operated?
A myectomy.
Right.
They had explained to me that there are chances that I would bleed out. With that being said, if I do bleed out, my womb would be taken out. But they will do everything in their power that they keep my uterus in because I don't have children. And clearly in the future, I'd like to have children.
Okay.
Which went accordingly. Happy. I'm just happy.
Right.
It went accordingly.
So did they remove all of the fibroids that you had, or did they choose?
No, they
only
removed
a few?
all of the fibroids.
Right.
And I'll just be honest. And then I also have one fallopian tube at the moment.
Right.
Because one of my fibroids was attached to my fallopian tube.
Oh, okay.
So they had to remove that one as well.
Right.
But everything else is intact.
Oh, that's great. So you're looking forward to your first pregnancy in future?
In future, not now.
That's great. How about you, Kekeletso?
No.
In terms of pregnancies, that is, yeah?
No, I have a son.
You have a son?
He's turning 2 next month.
Oh, that's wonderful.
I fell pregnant in 2016.
Oh, so you fell pregnant after the embolization?
My myectomy.
Oh,
this doctor said, no, just try so that you can see what is going on. Then, luckily, I fell pregnant.
That's wonderful. Well, ladies, I mean, this is very inspiring stories from both of you. And thank you so much for sharing the stories with us.
Thank you.
All right. Perhaps, Dr. Matsusa, I mean, is this what everybody goes through? Or is it just a lucky few, these lucky 2 ladies?
No, I think we need to move away. We've got so many options for treating fibroids these days.
Yeah.
And yes, long time ago in the 1700s, and possibly even sometimes when I was training, where we'd say if a patient has fibroids, then depending on the size, then you have to remove the womb. Yeah, okay. And it's really not the case, in this day and time.
We're going to talk more about all the treatment options, but for now, ladies, thank you so much for sharing your stories with us, okay?
Thank you.
Well, time for a quick break. When we come back, we're now going to start talking treatment. Please stay with us.
We are tired and we want people to take action. We want government to take action because women are being raped, women are being killed, women are being sexually and physically abused every day. Children are going missing.
See men at the forefront of this march is what softens the heart and makes us all feel proud of the type of men that we have in our country.
Here, the rates of violence against women and children are alarmingly high. Enough is enough.
Every day and during every hour of our time beyond sleep, the demons embedded in our society that stalk us at every minute seem always to beckon each one of us towards a realizable dream and nightmare. With every passing second, they advise with rhythmic and hypnotic regularity, get rich, get rich, get rich.
If the king will be involved in looting community money from a society bank, it's so shameful.
These people must sell their properties to give back the money. They are done auditing, so they must give back the money. Whoever took it must pay back. It is painful to wash clothes here.
Welcome back and thank you so much for staying with us. If you just joined us, we're talking uterine fibroids and I have my special guest, Dr. Lusanda Mashope Matsose from Charlotte Matlake Johannesburg Academic Hospital, and we're now joined by 2 other guests. First gentleman in the middle is Professor Litsibe Tsatsi, who's an interventional diagnostic radiologist, and he's based at the Netcare Police Hospital. Welcome to Health Talk, Prof.
Thank you, sir.
All right. And of course, we then have Dr. Yana Mostert, who's no stranger to this show, by the way. We had her recently. She's a homeopath, and she's going to share with us her experiences of treating fibroids from a homeopathic point of view. Welcome to Health Talk once more.
Thank you for having me.
All right. So perhaps let's unpack the principles of treatment for fibroids. We may have touched on, we had two ladies here sharing their stories with us. Perhaps let's start with you. What are the principles of treatment around fibroids?
So, first principle is you need to find out what's actually bothering the patient and what they want. When I say what they want, in terms of do they want future fertility or they don't want future fertility. So in other words, does this woman still want to bear kids or wants to bear kids at some point in time of her life, or she doesn't? And secondly is to get the safest possible treatment option for that patient after discussing with her. And obviously with that, you need to discuss the pros and cons of the various treatments.
Right. Okay. Let's just have a quick break and take a caller. I think it's Ningi, if I got the name. Mingi. Welcome to Health Talk, Mingi. Is Mingi there? All right, we'll come back to Mingi. Prof, perhaps let's understand. You're an interventional diagnostic radiologist, so yes, it's a bit of a mouthful for people watching this, program. What exactly is that, and what do you do in terms of fibroids?
Essentially, we try and treat patients by using the most minimally invasive methods and ensuring that we can achieve that. For example, instead of opening the tummy, we'd be able to enter the abdomen in a different way. For example, for fibroids, we put in a very small catheter, like you'd put in a little drip.
Yeah.
It's a catheter maybe about 120, 130 centimeters that comes in through your wrist, goes all the way down. Yeah. And when you get to the uterine arteries, you'd occlude the vessels to a certain point.
So that is embolization.
That is embolization.
All right, we're going to come back to that. I just wanted to hold that thought a little bit and take Lingi back. Lingi, hello.
Hello, doctor. How are you?
We're good. How are you, ma'am?
I'm well, thank you. I just wanted to find out what is the difference between cysts and fibroids.
Excellent question. Thank you so much for that. Let's give it to Dr. Matus.
Okay, so fibroids, like I'd mentioned, is tumors that grow in the uterus, in the muscle of the womb. Cysts is anything that grows outside, and you get different types of cysts as well. So typically it would be ovarian cysts. So there's a cyst that grow alongside the ovary. And then with that you can get simple cysts, you can get complex cysts. So they're two different things. One is normally a fluid-filled structure, but it can have pus as well. And then the other one is a solid mass that grows in the lining of, in the muscle of the womb.
And I suppose the person that can tell us that difference is Professor Tsatsi.
Yes. Essentially, cysts tend to be fluid-filled, as the doctor accurately described. They can be fluid-filled, they can be complex, and they cannot be confused so much with fibroids because cysts don't tend to occur a lot in the uterus. Maybe in the cervix they do occur, but they're usually very small.
Yeah, I guess I was saying from a point of view of you then, doing the diagnostic parts, the radiology, the scans, and so on. Yeah.
We will diagnose fibroids using firstly ultrasound, but the most accurate here is an MRI. Because an MRI is going to show you not only the fibroids, ultrasound tends to be, it'll give you very focused images, but MRI allows you to have a global view. You can count how many they are and you can follow them because once you've embolized them, we're going to follow them into 2 years or so and make sure they completely shrink.
All right. I'm not going to get into the argument around the cost and the ethical stuff. We'll get there. But let's bring in Dr. Mostert. I'm looking forward to hear exactly what the treatment principles are from a homeopathic perspective of fibroids. Please educate us.
Okay. Mostly when patients come to see me with fibroids, they are already working with a gynae, and there are already scans that have been done, normally ultrasounds that have been done. So we've normally got an idea of how many there are, how big they are. And then treatment is normally focused on trying to get hormonal balance restored. Because mostly, in my experience, I find that there's often a little bit of estrogen dominance. In other words, that there's too much estrogen in relation to progesterone in the body. And instead of, I don't really like to give things to specifically boost progesterone too much. I like to give remedies that actually helps the body to restore the balance itself. So
what does that then do to the fibroid? Does it slow progression, or does
it slows progression, and it gives the body time to break it down itself. But there are actually remedies or supplements that I would give at the same time, which help the body, give the body the tools to actually break down the fibroid itself. And normally I would say we get quite good results unless the fibroids are just too big. You know, for example, the one that the lady spoke about that was 20 centimeters would be just beyond the scope, you know, of what I would work on.
Well, which brings me to that question then, to say, you know, what type of ladies come to you, and at what point you say, no, hang on a second, this I can't deal with, please go back to Dr. X. And this I can try and deal with.
Generally, I like to be in contact with a gynae to make sure that we can actually take 6 months to put the lady on treatment. That there's nothing that is dangerous. For example, that there's no pressure on the tubes going to the kidneys. That there's nothing that should be addressed immediately. So normally I ask the gynae for a leeway of about 6 months. And then the remedies that are given are normally very individualized. So, for example, if I see a patient that comes in with constipation due to the pressure, quite a lot of bleeding and quite heavy pain going into the back, they would get one remedy called calcarb. There's a variety, but just to illustrate, if it's mostly bleeding, if it's a lot of flooding, you know, that sanitary wear can almost not really take care of. If she can't almost leave the house, there's another remedy called phosphorus. And you spoke about the older ladies. So if there's a lady that's closer to menopause and she's bleeding 4 weeks of the month, then there's 1 week that she's not bleeding, then she's bleeding again, going into iron deficiency, anemia, hair loss. You know, if it's getting to that stage, there's another remedy called Sabina that I find works quite well. So the choice of the remedy, it's quite specific what they're given according to the pictures, how these normal fibroid symptoms present in each different patient.
Okay. This is very interesting. I mean, for me, this is something new, and I'm not sure to what extent it's well known. Perhaps let me get a comment from you to say, I mean, obviously, we're moving towards, or maybe we should be there already, that, you know, management of conditions is multidisciplinary.
Yes.
To what extent do we work with other professionals in treating this condition?
Well, in my specific experience, we do work closely to interventional radiologists. I must admit, we've never really had experience with working with homeopaths with regards to fibroids, because it's always been, it's one of those common disease processes that we see, and we manage them according to any new information that actually comes out. Like now is the interventional radiology in terms of HIFU and uterine artery embolization or operative. There is medical treatment, but not necessarily, in terms of my practice, homeopathic treatment. And I agree, we are getting to a point of multidisciplinary approach, but I've personally got no experience with homeopathic.
A lot. Most of our patients may come, for example, from physicians who see patients with anemia, and they then get treatment. I've had a very interesting case of a woman who was working in England. She was a doctor, bought lots of shoes, and her feet started swelling. She didn't know what was happening. They thought she might have deep vein thrombosis. We checked her out for it. There was nothing. And lastly, just did an ultrasound, find massive fibroids. She got treated, and she's normal, wearing her shoes again, and she's okay. Now, the beauty with this is it is end stage. You don't have to go back, because sometimes, you know, myomectomy has a nice place, but sometimes they do recur. And then it creates a problem, because now you've breached, you have to go back again and do the same procedure. Most of the patients that get fibroid embolization are actually a one-stage procedure.
In fact, I think this is a good point to just end here, because we need to go for a quick break. And before I go, I need to thank you so much, Dr. Mustard, for sharing this information with us on homeopathy and enlightening us. Well, thank you so much.
My pleasure.
All right, time for a quick break. When we come back, we now hear more about this embolization. Please stay with us.
Last week, residents from these areas embarked on a shutdown which turned into violent clashes with police in some areas. Protests were expected to resume today, but the Gauteng Shutdown Coordinating Committee says there's been a change of plans. What are those changes?
So what has been going wrong is we've had all of these shutdowns in our communities. So that means that these communities are disabled, there's no activity happening there, and then we are breaking down our own communities. What we must do is we must take the fight to the powers that be.
We're coming to the powerhouses, and the JSE is the platform of all the powerhouses. We are coming here. This is notice today.
We will consider this and then we will be in touch with you.
If they don't respond to us within 7 days, we will begin to cut what we call the economic blood flow of these organizations.
News at 9. We go beyond the headlines of the day and breaking news to bring you all the angles and in-depth analysis of stories that impact your life. We are on the ball with all economic stories. Our bureaus around the globe are ready to connect you to events as and when they happen. So join us every day at 9 to zoom in on the day's big stories.
Welcome back. We're talking uterine fibroids with our guests, Dr. Lusanda Shimange Matuse and Professor Letibe Tsatsi. And let's continue the story on treatment. This is really getting interesting for me. We spoke about, methods of treatment, surgical. You had touched on something earlier to say there's medical treatment.
Medical treatment.
Please just expand on that a bit.
So with the medical treatment, and that's more for symptom control.
Right.
It's not really to take away the fibroids. So that's someone who comes in complaining of heavy menstrual bleeding, and they're not really ready to commit to an operation or to radiological treatment, and they just want to go and think about it, because not everyone is just willing to go under a knife or try new methods. So with those patients, then we put them on medical treatment, but that is just to control the symptoms. It will not take away the fibroids. But that's more the hormonal treatment. There is other treatment where we can shrink the fibroids medically to control the bleeding, but with that, it's not medication that you can use long term.
Right.
And usually once you withdraw that treatment, then the fibroids grow back.
Okay. Let's take Bashia on the line from Durban. Bashia, welcome.
Hi.
Hi, Bashia.
How are you?
Good, how are you?
I'm fine, thanks. I've been just diagnosed with a fibroid. I think it's just one because they did an ultrasound on me on Monday.
Right.
And I actually saw 2 gynaes at King George. And the last gynae that I've seen, he asked me to, he said maybe I can do like a hysterectomy.
Right.
And the thing is, I do not want to remove my entire uterus because I would like to conceive in the future.
Right.
So what other options do I have? Because I'm only 31 and I don't know what to do.
All right. Let's perhaps ask the experts. Would you like to ask a question or two perhaps before she goes? No?
Could you tell us her age?
She's 31.
She's 31.
31.
Yeah. Okay.
And how do the fibroids bother her?
Are you still there, Bashia?
Yes, I am.
How do the...
I just had like severe pain in my uterus, but that was it. I didn't have like very heavy bleeding. It just stopped my period for like 3 months until I got back onto my contraceptive.
All right. Okay. Thank you very much. Okay. Obviously, we can't talk about individual cases. Let's just talk generally about, options that she's got.
With her, personally, if I saw her, it would be pretty straightforward. She's already said, I want to have kids.
Yeah.
And that should already be something where, okay, so hysterectomy is not actually an option in this patient.
Right.
You know, so anyone who comes in who's got fibroids and says, I still want to have kids, then you know, okay, we're not even going to discuss the removal of the womb. And I like what Prof said, saying, I mean, we've got access to ultrasound very readily, but MRI, depending on whether you're in the public sector or in the private sector, is not something that you will just get. So in an ideal situation, then you'd want to take the patient from MRI to fibroid mapping on an MRI, see where the fibroids are and see, is this fibroid really going to affect her fertility in the future?
Right.
You know?
So the one option obviously is embolization.
Sure.
Please just tell us about this procedure. What is embolization?
Embolization entails, it's a process that started maybe about 20 years ago.
Right.
And it was discovered by accident. And I'll give you a short story. In Europe, a gentleman used to do lots of myomectomies and hysterectomies for fibroids. And the list grew so big that they found that they had to start stopping these ladies from bleeding while they're waiting for their appointment 6 months or a year down the line.
Right.
They then embolized these ladies, meaning that they blocked the uterine arteries.
Right.
These ladies came back only in a year to find out the fibroids were gone and a new procedure was discovered.
Very interesting.
So it's not anybody's, it's
Very,
accidental.
Very, very interesting.
But it
But
works.
before you continue, let's take our last call, I think, for the show. LC on the line. LC, welcome.
Hi, how are you?
We're good. How are you, LC?
I'm good, thanks. Yeah, my situation is just ongoing, hey?
Right.
I was diagnosed with cysts. I had cysts, and the pain and the menstrual cycle was not normal. Then I went back. I then found out that I have endometriosis and a small fibroid. And then we had to go for a procedure, the laparoscopy, to remove that. And unfortunately, the pain wouldn't go away. So I went back to my gynae. Then he recommended that we do the MRI scan, of which we did. And unfortunately, the results came back saying I have the adenomyosis. And the one that I have is spread across the womb. And I was told that I will have to remove the womb. But what are my chances of falling pregnant? It's like my illness doesn't stop. I live with pain on a daily basis, the bleeding. So it's just too much, hey?
Right. We're so sorry for that story, but let's get a comment from our two experts. Yeah. Good.
This is very interesting because a number of people, especially abroad, have done studies on adenomyosis and its management in the same way, embolizing the uterine artery with variable results, and some patients have done extremely well. So it's an option she can take, but obviously the gynaes tend to handle most of those patients, but those that they fail in and those who may not wish to go that route will have an embolization.
So before we run out of time in this, and I'd like us to dwell a little deeper into embolization. Access. Who does embolization, and where can people get access?
Thank you. Embolization is done predominantly by radiologists. Radiologists are usually people who read your X-rays, your MRI, your ultrasounds, but there's a small group of them who do interventional work.
Like yourself?
Like myself. Right. And they focus on that. Some of them work in the head. They're called interventional neuroradiologists.
Yeah.
And access, if you went into a hospital and asked, they may, or your specialist may be able to lead you to one of them. If you go online, you'll find names of people. And the worst is you can just get to the Radiological Society and they'll point you to
Is it
people.
only in the private sector or in the public sector?
Both sides. There are lots of people. I did, for example, when I did this young lady, I was working with the public service. Yes.
Unfortunately, this is where we're going to have to leave it. Unfortunately, the time often runs out so quick when you're having so much fun. Thank you so much for your contribution.
Thank you.
We're educated on fibroids. And for you folk at home, thank you so much for watching. We're back on your screens again in a week's time. And until then, please do take care.
buildings, submerged homes and devastated families.
Biggest earthquake in here.
Their homes and buildings moved like boats.
Big shake, and I ran as fast as I can.
These are the satellite images depicting the area before the disaster.
The ground is like a wave.
I've never seen anything like this in my life. It is unbelievable. You can actually smell the stench of dead bodies around.
The National Hurricane Center said earlier on Tuesday that Michael was a Category 1 storm with sustained winds of up to 150 kilometers per hour. Residents were implored to get out of harm's way ahead of life-threatening waves, winds and rains. Flash flooding over the weekend caused 13 deaths in Central America after Michael formed off the coast of northern Honduras.